Hey everybody, I'm Jill Redfern and welcome to Third Shift Movement Shop, home of Literal Technique. This tutorial is about alignment of the ribcage barrel. But before we start talking about the ribcage barrel, I want to back up a couple steps and talk about the 33 vertebrae just briefly, which will set us up to talk about the ribcage. So you may remember from the tutorial on the alignment of the skull that we talked about the anatomical curves of the 33 vertebrae as one structure. Cervical curve in, thoracic curve out, lumbar curve back in, and the sacrum and the tailbone curve back out. So this is our anatomical curve starting point. When we talk about neutrality of the 33 vertebrae, this is where it is. So before we start flexing, extending, and rotating the vertebrae, this is our neutral alignment. So the thoracic vertebrae start at the first rib, or rather the first rib starts at the first thoracic vertebrae, and the 12th thoracic vertebrae is here. So this group of vertebrae are our topic today. The rib cage barrel attaches directly to these 12 vertebrae. So, but let's stop, and I want to say a couple things about the rib cage barrel. In Literal Technique, I call this a barrel. It's a 360-degree barrel. It isn't the reason I call it a barrel is to get us out of the habit of thinking about the rib cage as parts that aren't connected to anything. In fact, the 12 ribs come as a group, except for the 11th and the 12th, which are the floating ribs. These two ribs do not attach to the sternum, but ribs 1 through 10 do. And they attach to the sternum through their cartilage, which is this sort of clear plastic thing you see on skeleton. So we've got 10 ribs attaching to the sternum. This is the sternum. The sternum is one bone. Anatomy identifies 3 aspects of the sternum, but they're just names of sections. The sternum is one bone. The first aspect is the manubrium. Then there's the body of the sternum, and then this little pointy thing is the xiphoid process. So the sternum articulates, which means it joins with another bone at the collarbones and at ribs 1 and 2. Ribs 3 through 7 attach directly to the sternum through their cartilage. Ribs 8, 9, and 10 have a sort of a cascading attachment. 10 cartilage attaches to rib number 9's cartilage. Rib number 9's cartilage attaches to rib number 8's cartilage, and 8 attaches to 7, and that's how these 3 attach to the sternum. So this is a pretty fixed situation. The ribs and the sternum are attached to one another. They don't have any moving parts. They can't move independently of one another. The only thing that moves in the rib cage barrel are the vertebrae. So anything that the rib cage barrel does, that means the vertebrae are moving. So that's where our alignment begins. Alignment of the rib cage barrel is derived directly from the 33 vertebrae. Specifically T1 to T12. Okay, a couple things about the thoracic vertebrae. First, as you can see, as we said, they curve away. They have an anatomical flexion, right? Of about, I think, 40 degrees or something like that. Again, these are all depending on the person. These vary, so all of these degrees are approximate, but they have a flexion anatomically of about 40 degrees. We can flex the thoracic vertebrae forward at about 30 to 40 degrees. We can flex them laterally to the side. Laterally means side at about 30, 40 degrees. And we can extend them about 35 degrees. And extension is a little less than the flexion because you're extending on top of something that's already flexed. So depending on your vertebrae, extension for you may be just a little less flexion. But what that tells us though is that the movement of the ribcage barrel is basically the same amount of degree all the way around. Okay, so one of the things that's significant about understanding flexion, extension, rotation, and I'm sorry, rotation happens at about 30 degrees. Let's do that to the side. So again, it's all in the same approximate amount of degree of turning, flexing, and moving. So that's important for us to understand because sometimes it's difficult to know when you're curving the upper body, when you're moving and flexing and extending the upper body, it's hard to know where that's happening from. And it's easy to get down into here to start the movement of the middle and the upper back. The reality is that T12 is about where you want to stop thinking you're going to be doing any kind of movement from. Any lower than that and you run into the lumbar, which have different degrees of movement. So that's important to understand. The other thing that's important is that alignment of the ribcage barrel is a pretty significant thing when it comes to executing complicated movement. And it's really possible to be slightly arched in this part of the back and think that you're neutral. So we have to be really perceptively aware, maybe that's redundant, of what the vertebrae are doing. Where are they? And where is the sternum and the ribs? Because any amount of extension in the thoracic vertebrae will pitch the rib cage barrel up, right? I mean, it moves when the vertebrae move, and if they're trying to extend for whatever reason, the rib cage barrel is going to move. So understanding that the vertebrae are where movement and alignment begin will help us make alignment corrections, sometimes midstream, but certainly while we're standing upright, preparing to move. So when you're in class this week, think about and try to feel where your thoracic vertebrae are. Are they slightly extended? Are they slightly flexed? Either one is going to change the alignment of the ribcage barrel. Once the alignment of the ribcage barrel is off, it has the potential of mucking up the alignment of the pelvic barrel and also the skull. So think about that in class this week, and I'll see you next week.